All right, thank you guys. Name's Eric McKillican. Little bit about me. I'm going to take a 2-hour lecture that I give at the college, cram it down into 5 minutes for you. I'm a second-generation chiropractor. I was born into the hands of a chiropractor at home. I've never been vaccinated a day in my life. Right. I've been checked from day one on. Even with that kind of a pedigree, it doesn't mean we have it. We can always, and the gift that was given to me from one of my biggest and most amazing mentors, you heard his name a lot tonight, was Dr. Joe Felicia. One of the biggest gifts he gave to me, and the topic of this talk is about shift, and how we can shift our mental capacity to a little bit higher level. I'm going to get into some things here today that is about shift, but I want to talk, and I want to start it off with just a quick game. The question is do the words we use define our profession? Are we unique and distinct? And so I'm going to play the game, name that profession. I'm going to shoot out some words, and you guys are going to guess what I'm thinking of. All right, so here it goes. First is hammer, nail, wood. What profession?
Carpentry.
Carpentry. Good. Wires, fuse boxes. Electricians. Good. Floss, cavities. Dentistries. How about if we went with white coat, stethoscope? MD, exactly. How about if we took it another step further and put scrubs on him and a scalpel in his hand? Surgeon. So the words we use are unique to our profession, aren't they?
Yes.
How about our profession? Our profession was founded on what? Tone. Our profession was founded on a concept of tone. What the hell is tone? We're talking about vibration. We're talking about waves. We're talking about force. Where in the world is that? What does that have to do with neck pain, back pain, headaches? Allopathic world? Not a bit. It has to do with tone. Vibrational healing through the hands. This is what chiropractic was founded on. So, I want to read something really quick. It's a definition. It's by Kenneth Hudson in the book, just went out, don't worry. If one wished to kill a profession, to remove its cohesion and its strength, the most effective way would be to forbid the use of its cohesive language.
Exactly.
Mm-hmm.
So I want to talk about our cohesive language. What do we talk about when we're in the office? Better yet, what do we talk about when we're in our head? What do we think about when we think about subluxation, when we think about chiropractic? Let's start off with some of the very, very basics. When I talk to my children, I talk usually in the positive instead of the negative. And what I mean by that is, in the negative is, don't forget to do your homework, honey. In the positive is, hey, baby, remember to do your homework, please. Which is, you guys get the difference? Positive versus negative. So what is the difference? Which one's positive, which one's negative? A patient versus a practice member. To be a patient, you need to be what? Sick. Why do we call them patients? They're practice members. To be a practice member, anybody can come in, right? There's no criteria. You can be a practice member. Let's see, I've got a list of them. How about this one? Exam. Do we examine people? Do we? Do we examine people? I mean, come on. We evaluate, we check. We analyze. We clear. Yeah. This one's an easy one. Manipulation. Some of us actually don't see the difference between manipulation and adjustment. Manipulation, in a definition, is about restoring mobility to a stuck joint. Or just moving a joint. What's an adjustment? Restoring life. You add to the component of that mental flow. The intent up here is now totally different. Totally different. Segmental dysfunction. Do we want to lose the word subluxation from our vocabulary?
No.
At all? In any way? Just reduce it down to a segmental dysfunction? The term walk like a duck, if it walks like a duck, if it looks like a duck, if it quacks like a duck, if it sounds, it's a duck. The fact is if we put on white coats, if we put on stethoscopes, if we do medical things, guess what we are? We're the medical duck. So I want to finish with this. I mean, there's a whole bunch of terms here. Chiropractic medicine, physician, diagnose, modality, therapy, treatment. I want you to reframe those. Turn them into a doctor of chiropractic, to an analysis and an adjustment. But before anything, the gift that was given to me by Dr. Joe, and I think he hit me upside the head with that book that's like this thick, scrambled it a little bit, and got it really solid. Define for me nervous, would you? What's nervous? Anxious. Apprehensive. Now tell me, does nervous belong in front of system when we're talking about this valuable system that controls and coordinates all the functions of our body? Sure. Does it belong in front of that? No. What is this system that controls and coordinates and literally houses our life force? Guys, it is the nerve system. It is the nerve system. Dr. Joe hit me upside the head and I went, whoa, that makes so much sense. I'm going to close with this. BJ said this, that the path of least resistance makes rivers and men crooked. We as chiropractors have never once, true chiropractors, we're rabble-rousers, we're SH disturbers. We go against the grain. We do not follow the path of least resistance. Be okay with it, embrace it. God bless you guys.